Well, this is great to see such a large crowd here today. I'm so excited that there are so many people that are excited about the private ownership, private practice in dentistry. My name is Kim Harms, and I was president of the Minnesota Dental Association in the year 2000. Now, I hope you were all born by then, the year 2000. I brought in the millennial, and I brought in the millennials probably at the same time. So I was president years and years and years ago. But the reason I'm here is that I also practiced in many different settings. I graduated from the University of Maryland, and I practiced in the Public Health Service, U.S. Public Health Service, and the National Service Corps for a few years. I then went on to do residency and taught at Loyola University Dental School, which was probably closed down before any of you were born, but I did practice there for a while. It didn't close down because of me. It was after I left it closed down. I had nothing to do with that. And then I went in private practice with my husband, Jim, in Farmington, and I practiced there for about 30 years. And while I was practicing private practice dentistry in Farmington, I also helped to the state to develop a program for the developmentally disabled working in group homes, and we're in group homes now that used to be in the big state facilities. So down at Faribault, I got the program down there. I got started down there in Faribault, and at the end of my career, we were kind of selling half of our practice off, and I worked part-time as an associate for Nathan Peterson back there. He was a great boss. So if any of you ever have a chance to work with Nathan up in Hibbing, he was a great boss. So I've kind of been around the block in a lot of different areas in dentistry. And I've also worked at the ADA. I was a national spokesperson for them for 21 years, and I was on their communications council and their government affairs council. So I've kind of had this broad view of dentistry. And I do believe absolutely it's the best profession ever. But my favorite part of dentistry is private practice ownership. And the reason that's my favorite part is because you can customize your care to what you like. And so you can make that office your own. You practice the way you like to practice. You have that direct relationship between you and the patient. We were in a small town. Farmington only had 4,000 people back then. It's got 22 now. But it's a small town. We knew everybody. We were part of the community. It was a wonderful, wonderful, wonderful life. We raised our children there, and I just can't ask for a better life than that. So I'm so blessed that I was able to become a dentist. So we're here to talk about entrepreneurship. So what is an entrepreneur? Basically, entrepreneurs design and launch businesses. And you might be designing and launching a startup business, or you might be buying another business and perhaps taking what the other business started from where you bought it and launching it onto something else. So I really consider it entrepreneurial even to buy an existing practice. So you don't have to start from scratch. Although starting from scratch is still viable in a lot of areas of the state, particularly in the outstate areas. So what is a dental entrepreneur? Now, each of us has our own idea of what our dreams are. You know, some people happy in the clinic. I think that's one of mine. I love just being happy, going to work, being happy, having a good time, not having the stressors that you might have when there's other interferences between you and the patient. You could feel like maybe you want to make a lot of money. That's a possibility. But my closest one is probably this one down here with your family. My husband and I practiced in Farmington, and we were able to, and my daughter's here today, she can attest to this, we were able to make every single game. We were able, every single event they had at school, we could be there for them because if there was something we needed to do, we just took the day off. So we had control over that. And that was a wonderful thing about practicing dentistry when you have control. So where do you want to practice? You can practice, there's so many different areas. There's a corporate world, there's a public health world, and there's the private world, there's the associate world. Where do you want to practice? It's important for you to decide right now, think about where do you want to practice, where do you want to live your life, how do you want to live your life? And again, many of us do segments here, segments here, segments here, segments here, but in the long term, you need to really come up and decide what plan do you want to have? Where's your plan? So there are many, many, many practice choices. You can do that anywhere. But there's one clinical reality. This is what we look like to our patients every single day. This is what we look like, and I love it because we kind of look like Martians. You know, we've got Martians. We got the cover on our face. This is Cindy Sundet. This is my dentist, so I know this is an accurate picture. I took it myself. But the thing I love about it is, no matter how old you are, you look the same. So you got the glasses, everything's covered up. I look like I'm 15. You know, when I'm down there. So it's a really great thing. But really, this is how patients look at you. This is what they see. And the reason I show this is we do some really crazy things to our patients. You know, we're in there, we're drilling, human tissue that they see kind of flying out of their mouths. They let us do a lot of wonderful things to them. And they have trust in us to do that. So we are so blessed that we have patients that they're willing to come in and get this done. And the reason is they want to have beautiful, healthy teeth. And in America, we are known for the beautiful, healthy teeth. If anyone ever travels abroad, that's how they can tell we're Americans when we smile. So this is the clinical reality. This is where we all end up, right there. So what keeps you up at night? Why aren't you all out there running out there right away, starting your own practices? What keeps you up at night? First of all, this is an ADA survey, and I just want to tell you that the American Dental Association has a survey program, so you can call the American Dental Association, and and this is one of their surveys. So these are young people. What keeps you up at night? The first one is providing the best care. People worried about providing the best care, right? You want to do a good job with the care. The second is staff issues, working with staff. That's a big issue. Debt right now for your group is a big issue. Insurance companies are a big issue. And not enough patients or cash flow. These are all big issues that many dentists are afraid of when they come out. They're worried about that in a private practice. So I went to school and I graduated in 1981. And I don't even want to show of hands of who was born, after 1981, because it would be, there's a few in the back here. I know a couple, you're my age, there's a couple back there. I was born in 1981. And the reason I show this slide is that we had the same issues. And we were really cool. I did have a perm. A little bit later, we thought we were very cool anyway. And don't laugh, because in 30 years, somebody else is going to be out there and you're going to be up here and you're going to look like this too. So don't laugh too much, don't judge. So anyway, 1981, we had the same issues, the best care, staff issues, not enough patients, the same issues that you have. However, we didn't have debt, but in 1981, the business interest rates were 21%. That's not that was not a typo up there. 21%. Also, we were told capitation was a big issue then. So we thought that we'd go out to practice, and everyone would be capitated. So you'd get paid like $5 a month to take care of a patient, which if you did good care was not really enough to even support your system. We were worried about capitation, and the biggest thing we were worried about is Sears was just opening their first dental clinic. And they had taken over optical. So we thought we'd all be working for Sears. And Sears just declared bankruptcy this year. So none of these things worked out, but these are things we were worried about. So what I'm saying is, be careful about what you fear. You don't know this is going to happen. So high interest rate versus high debt. If you have a 20% interest rate and a $5,000 loan, over 10 years, you're going to pay $1,179,493 payout. If you have a 5% interest rate like you have today, in a $500,000 loan, you'll pay $636,393 total payout, which means if you have a 21%, and I even did 20, it's less than 21, so this is low. So at a 20% interest rate, you pay $543,000 more than with a low interest rate. So if you might have the debt, but we were paying out this much more in interest. So it's really important for you to know that it's really important to know that the class of 1981, we not only survived, but we thrived. We did very well over the years. And almost all of us were private practice owners, despite the high interest rates that we had to endure. So how do you sleep well at night? What do you need to do to sleep well at night? First of all, you need to keep the patient's need first. Always, 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 always do that. And do the very best you can. Are you going to make mistakes? Yep, you're going to make mistakes, but do the best you can. Be an intentional leader with your staff with clear expectations, and this is where people get in trouble because they don't have clear expectations. Empower your employees and hold them accountable. Okay, that's the other part. Empower them to do the job you want them to do, but you have to hold them accountable. And there's lots of accountability techniques. It's not hard if you can get a system down. It really is not. And the last one is don't slouch. And I really mean that. Work hard. You might think that means work hard, don't be lazy. That really does mean that, but also don't slouch. Keep your posture in good shape. Your mother was right, as hard as that might be to think about. Your mother was right. When I was 53, I had a neck injury from slouching that affected my drilling fingers, of all places. And I lost my ability to practice dentistry when I was 53 years old, clinical dentistry, because I slouched. So do not slouch. Keep your necks high. Don't slouch. So investigate the numbers. Look at the numbers over a lifetime. How many days of work per week would it take you to earn your target income in each delivery system in 5 years, 10 years, 20 years? Look at the total picture, because the short-term picture might look very different than the total picture. If you want to retire, I could retire at 53 because I did everything else right earlier on. And also, look at how your decisions today affect your ability to retire tomorrow. Very, very important. And then finally, sorry, I was going the wrong way. So you might be afraid, you might be nervous and afraid about going out into the world, into the private practice world right now, because it might look a little scary to you. But realize that it looked really scary to us back in 1981. And we're the ones that are selling our practices to you, by the way, so you can see how well we did. So don't be afraid. Don't let fear be a barrier. Take a look at all the issues and all the numbers. Don't let fear be a barrier, because if our generation, you saw us with the curly hair and everything else, we were kind of crazy. If we could do it, and we did, then your generation could do it. So thank you very much. Our next speaker was born into a family. Both of her parents were dentists, and both of her parents wanted her to become a dentist, but she went into law. But her parents are completely vindicated right now, because she is now doing dental law, focusing completely on dentists, transitions, on employment law, on anything having to do with dentistry. And I'm really pleased to introduce to you my daughter and my boss, Hillary Harms Bichetti. Hillary Bichetti.